one of my mentors always said that thin people give themselves far too much credit for being thin. And I really do think that that's true. We know now that there are about 40 different genes that contribute to where and how much weight people store on their bodies. It's not just about the number on the scale, but a lot of the health impacts, the negative health impacts from carrying extra weight are dependent upon where you store your fat. So central versus peripheral fat storage. The colloquial term for it is apple versus pear shape, right? So more visceral fat usually means more health issues that go along with obesity, and those sort of things are almost entirely dependent upon our genes. It's not somebody's choice. It's not somebody's own behaviors. Obesity is a multifactorial disease. There certainly are individual choices and behaviors and educations that play into it. There are socioeconomic factors. We understand more and more now that healthy food is expensive, and a lot of people can't afford to eat all the fresh fruits and vegetables or don't have access to it where they might live. And then absolutely some genetic component to it as well. Obesity is probably the last disease in this country that people will openly and willingly discriminate against. It's commonly seen as just the patient's fault. It's their own personal behaviors or their choices or lack of self-control, when we know that the truth is it couldn't be further from the truth in most cases. So we focus on treating individuals as people that are have a set of circumstances that we don't judge. We don't judge why somebody has shown up in our door, but we certainly have the tools to help. And no matter how somebody got there, usually the story I hear is that people have struggled for their weight for most of their lives, and there's some sort of event, whether it's commonly pregnancies or some sort of injury or some kind of trauma, lead to a rapid weight gain that people just can't seem to get quite back down from. It's a really, really common story that we hear, and we know that the only durable long-term solution for obesity is surgery. I mean, if we've got 20, 30 years worth of data now comparing best medical management. You can see a doctor 5 days a week and be journaling your food and have somebody looking over your back at everything you do, everything you eat. But the results are not as good as an operation for weight. And the things that we try to help people understand is it's not just your weight that we're improving. There are non-weight related medical problems that are improved with surgery. These operations cure metabolic syndrome, which is most people consider to be an uncurable disease.